Adolescent illicit drug use is described as the use of illegal prescription or non prescription drugs used by individuals between the ages of 12 to 18. Drugs are classified as illicit if a federal or state government rules them as such due to addictiveness, harmful effects, or political reason. An example of the latter being marijuana. The DEA uses different levels of risk called schedules, with 5 being the least or no risk and 1 being the most dangerous. Example of Schedule 1 narcotics are LSD and heroin. Adolescent drug use is a harmful, maladaptive coping mechanism that can lead to addiction and substance abuse. Risk of drug use include increased risk-taking behavior and addiction. Sidebar, a government agency in 2016 addressed the harms of drug use in adolescents. These actions have led to inadvertent spread of HIV and AIDS through the sharing of needles and increased risk-taking behavior that has led to adolescents driving under the influence and being arrested or causing accidents. Two theories attempt to explain the reasons and causes for adolescent drug use: general strain theory and social learning theory. General strain theory uses the concepts of stress and failure to reach set goals as the reason people fall back on drug use. Agnew, the developer of strain theory, states that the societal strain to be successful, the failure to reach these goals, and the introduction of negative stimuli cause people to react in multiple ways. This pressure or strain causes individuals to become desperate and respond by finding illegitimate ways to attain this goal or collapse from the strain and withdraw from society. Carson et al. In 2009 found that there was a connection between the emotional standing of individuals and which response they have to stimuli. Feelings of anger led to criminal activity to earn money, such as robbery, while feelings of depression and disappointment are closely related to drug addiction. According to Agnew's theory, the main causes for adolescent drug use are related to feelings of inferiority and early victimization that build stress. This means that effective measures to counteract the issue would be focused on helping alleviate this stress through understanding mental issues and developing healthy coping mechanisms. SAM-HSA describes two possible methods to help replace the coping mechanisms within adolescence. These two methods are cognitive behavioral therapy and pharmacotherapy. Cognitive behavioral therapy uses communication and counseling to encourage positive thinking and self efficacy to increase the confidence within the individuals. This change in mindset creates a radical change in mindset that can reduce the artificial necessity of drugs and replace it with more productive activities. Pharmacotherapy uses the same method as CBT, but includes the use of medication to help mitigate the strain caused by early victimization, such as post traumatic stress disorder, or from pre existing mental illnesses that make individuals vulnerable to drug use, such as depression. The second theory addressing adolescent drug use is Acker's social learning theory. This theory places attention on the social norms and expectations surrounding an individual. This theory believes that deviant acts are birthed from actions and expectations shown within the home and community that someone lives. Actions perceived as desirable are then mimicked by developing adolescents to fit in. Trait strength is determined by how frequent they are shown in order of appearance. This creates situations where traits are stronger by how often they are seen and who is demonstrating them. This theory places emphasis on peers' influence on adolescents and even more so on peer pressure. A study by Ford in 2008 demonstrated that adolescents with substance abusing peers were more likely to report non medical prescription use of drugs and tranquilizers. Effective prevention in this scenario places attention on communities and schools to attempt to influence citizens to view drugs as undesirable, unwanted, and unnecessary. By using a community format and forming stronger bonds within families, adolescents will become less swayed by peer pressure and peers will be less likely to attempt to use drugs to fit in. Muck et al. Described an effective community format called the family-based treatment approach that focuses on creating stronger familial bonds that adolescents would prioritize over peers' ideas and beliefs. This closeness also opens up dialogue between the members of the family and allows the adolescent to ask questions and be confident in the parents' responses. Another method to intervene with adolescent drug use is by using community involvement. A parent by raising awareness and spreading the idea that drugs are not cool or impressive, adolescents will begin pushing away from drugs rather than encouraging their friends to participate. Examples of this method are the DARE program and SAMHSA's annual prevention week. Both of these methods attempt to change the societal idea of what is desirable through awareness.